our request to you today, but many people will take the floor as well, is of course to look where do we stand now at the end, after a year, all the things that have been put in place, but also partly also an evaluation, think of HERA and how to look at the future of HERA, but also the international treaty on the pandemic will be an important part.
There's a lot of work going on to implement the new regulation on cross-border threats to health and the extended mandate of ECDC. We are working on a rollout of an EU prevention and preparedness and response plan, and the national plans will have to align to this. And this EU-level plan should be ready by the end of this year. We are also now working on an EU network of reference laboratories so that member states can better cooperate at their level on cross-border regional threats. We are strengthening the EU system for early warning and response, including through digitalization. The Commission is working with the manufacturers to better align supply and demand for the vaccines. I want to share with you that a number of agreements have already been reached and discussions with BioNTech Pfizer are ongoing to find a solution to significantly reduce the amount of doses to be delivered and expand the contract's time frame beyond 2023. A lot of progress has been made in understanding long COVID, but we need more answers on the causes and on the effective treatments. So what we are doing now and what we have done, we are creating a network of national experts under the EU health policy platform to bring all the knowledge together and address challenges related to it.
Handled that I would like to focus on the member states. So we saw that that approaches.
I would like to understand why the direct representatives of the citizens are blocked to understanding better how this contract was made beyond redacted versions.
Mais ça résume bien finalement la position de la Commission. Je vous remercie.
Merci beaucoup.
Have to have full access to this contract, not the citizen.
Trop. On a reçu les doses 3 mois après les Anglais au début de la pandémie et à la fin alors que plus personne.
It's important for us to all understand that these negotiations for all the contacts from the beginning were all done by a joint negotiating team which consisted of the representatives of the Commission and of several member states.
We now have a mandate for our emergency task force, and part of the mandate includes a responsibility to coordinate clinical trials in emergency situations. But there is more work to be done. And for this reason, we are investing in a new initiative together with the Commission and the Member States called Accelerating Clinical Trials in the EU. We need to be able to increase our scientific assessment capacity very quickly, maybe by building up a reserve of assessors for crisis situations. We are working with patient groups and developers to better understand long COVID so that we can support the development and authorization of possible treatment approaches.
Revenir sur les nouvelles responsabilités de votre agence.
D'abord, les lobbies pharmaceutiques, excusez-moi. Le dernier temps qui me reste, en fait, je vais la consacrer.
What can the EMA do in addressing the increasing fragmentation?
We've put in place a working group with single points of contact in each of the member states to really figure out what's happening on the ground with shortages that could become a potential crisis. We're asking the companies to notify us in advance. We don't have a fixed notification time, but to, as soon as they think there might be a shortage, to let us know, because that helps us plan, helps us distribute the medicines across Europe.
Au bleu, nous sommes un peu plus pris au sérieux. On nous dit effet indésirable dû au vaccin, mais personne.
And we're part of this contract. Another question is in regards to the Wuhan Research Lab.
De rendez-vous chez notre médecin traitant, à savoir que Justine n'est pas allée voir de médecin depuis 4 ans.